So the gallstones are essentially stones that they formed in the gallbladder. So normally we use the gallbladder as a small reservoir of bile that we use after eating to digest the food, especially fatty food. And we don't know exactly why, but sometimes the bile inside the gallbladder can form some debris, and gradually, in time, this debris will form the proper stone. So they're essentially stones within the gallbladder, so to do with the liver function. So most of the time, actually the gallstones, so they might be completely asymptomatic. They don't cause any pain, but unfortunately, sometimes they can cause troubles. So normally, one of the symptoms is a pain in the right upper quadrant. Normally, I say is below the rib cage on the right side. Sometimes it can be radiated to the shoulder, to the center of the abdomen, and towards the back. This pain normally appears after eating, a couple hours after eating. As I said, especially certain food rich in fat or in oil. And sometimes it's quite common that the pain appears in the evening or even during the night. Quite typical, the patient awakes in the middle of the night with severe pain, which can last up to 3, sometimes even 6 hours. The other signs of gallstones are to do with the complication from the gallstones. First of all, it could be the infection of the gallbladder, so the cholecystitis, in which case the pain becomes constant, lasting the whole day and then a few days. This needs to be treated with antibiotics. Sometimes it requires a hospital admission because there is a small risk of perforation of the gallbladder. The other signs, it could be essentially signs of more dramatic signs, like severe pain, or jaundice, sepsis, because it could be the blockage of the bile duct, it could be the pancreatitis caused by the gallstones. Unfortunately, despite they can be very, very small, sometimes even at the stage of just debris, they can be dangerous because they can cause, as I say, the biliary sepsis, so blockage in the bile duct with subsequently infection in the bile duct, or they can cause the pancreatitis, which sometimes can be mild, but unfortunately sometimes can be severe, which can require admission to ITU with the respiratory support. And so, yes, the answer is, unfortunately, they can be dangerous. So the advice is normally that if there is some signs of pain or discomfort after eating, especially the fatty food, and there is any doubt, the first thing is to have an ultrasound to check for gallstones. In that case, if symptomatic, to have the gallbladder removed. Yeah, as I say, the main way to make a diagnosis of gallstones is an ultrasound. So the ultrasound is very, very simple and very important. It's the best way to identify the gallstones. Then after the ultrasound, there might be need to do other type of scan, like an MRI. But the first thing is ultrasound, and ideally some recent blood test with a complete liver function test. So the only definitive treatment for gallstones is the cholecystectomy, to remove the gallbladder, which requires a general anesthetic. There might be need for other treatment, endoscopic treatment, which are mainly to remove the stone, not from the gallbladder itself, but to remove the stone from the bile duct. But this it depends on the presentation and on the findings on the scans.